Hello everyone, my name is Ketut Vera Wulanprataminingsih, with student ID number is 2411011021 from the Guidance and Counseling Program at Ganesha University of Education. I am first semester student, and in this video is my middle test assignment for the inclusive education, guided by our lecturer, Mr. Wayan Eka Paramarta SPD. Let's dive into the topic. The first topic is about explain what is meant by inclusive education for children with special needs. Inclusive education, all children, including those with special needs, learn together without discrimination. It provides equal access by adapting curricula, teaching method, and facility to individual needs. Diversity embraced as a strength, enriching the learning process. Challenges include limited teacher expertise and inadequate facilities such as accessibility feature. Successful school address this with teacher training, learning aids like braille or hearing device, and accessibility infrastructure. This approach fosters academic and social growth for all students while promoting social awareness. Number 2 is about list the factors that cause a child to categorize as child with special need, discuss genetic, environmental, and prenatal and postnatal factors, including case studies or real example of common conditions such as autism or intellectual disabilities. The first is genital factors. It's about abnormalities in chromosome or gene mutation can lead to conditional like Down syndrome or autism. For example, autism is strongly linked to genetic factors, with research suggesting around 70% of cases in hereditary, though no single gene is solely responsible. Next is about environmental factors. Experimental factor is about internal influence, such as socioeconomic condition, exposure to harmful substances, or psychological trauma can also affect development. For instance, malnutrition due to poverty may lead to cognitive impairments. Number 3 is about prenatal factors. It's about issues during pregnancy, including infection, substance exposure, and advanced material age can increase risk. Example, a baby exposed to alcohol in utero may develop fetal alcohol syndrome, affecting physical and mental growth. And the next is about postnatal factors. It's about birth complement, brain infection, or inadequate nutrition during infancy can lead to development delays. For example, oxygen deprivation at birth, aplasia can result in intellectual disabilities due to brain damage. For study cases about a child with autism may exhibit difficulties in communication and social interaction, while genetics play a significant role. Prenatal factors like maternal viral infection during pregnancy can heighten the risks. In contrast, intellectual disabilities from postnatal issues such as birth asphyxia demonstrate how various factors contribute to special need development. To understanding this factor, help educator and parent provide appropriate intervention, ensuring optimal support for a child growth and learning. Question number 3 is about how disorder experienced child in need special influence develop psychological and social needs. The first is about psychological impact. To emotional challenge, many children struggle with frustration and low self-esteem due to difficulty in interacting with other environment. For example, children with intellectual disabilities may feel demotivated when unable to grasp lesson, leading to feeling inadequacy. For mental health risks, children with autism may experience anxiety or depression for challenge in understanding social cues, sometimes resulting in withdrawal or aggressive behavior. And for social impact, it's about isolation. To difficult in communication or social skill can lead to exclusion by peers. For example, a child with autism who struggles to understand play rules may be subject, reinforcing a sense of loneliness. For relationship barriers, children with communication disorders such as hearing Impairment often feel disconnected due to limited interaction opportunities. To support and solution, target interventions such as psychological therapy and inclusive social program in school are crucial to help ABK overcome this challenge and develop optimally both psychological and socially. Question number 4 is about mention challenge face child in special in environment education. What the impact to achievement academic day? The first is about the challenge. The first is inadequate facilities. For many schools lacks access to device, accessible infrastructure, or tools like braille or hearing aids. Number 2 is about untrained teacher. Limited teacher expertise in addressing the diverse needs of ABK hinders adaptive learning method. And the third is about social stigma. To negative attitudes and exclusion reduce self-confidence and motivation, further isolating ABK. Next is about impact on academic achievement. The first is about lower performance. Two, insufficient research and non-adaptive teaching method often lead to poor outcomes compared to peers. For example, children with intellectual struggle to understand unsimplified materials, and the emotional challenge to social exclusion or frustration can affect concentration and engagement in learning. For example, a child with autism may struggle in group activities without appropriate support. To improve outcomes and inclusive approach with tailored support, teacher training, and accessible facilities are critical in helping ABK achieve their academic potential. Question number 5 is about provide recommendation for handling that can be carried out by teachers and schools to maximize the potential of children with special needs in regular school. To maximize the potential of children with special needs or ABK in regular school, teacher and school can implement the following recommendation. The first is about curriculum modification learning strategies. First, we can adapt the curriculum with differentiated text and teaching method tailored to individual needs. For example, we can use visual aid for children with reading difficulties. Next is about allow additional time for assignment can exam to reduce stress and enhance understanding. Next is about supporting learning environment. To create inclusive classroom in accessible seating and comfortable layout, and then promote a culture of inclusive to empathy education, such as group discussion about diversity and teamwork. Number 3 is about teacher training and expert support. It's about provide teacher with training and inclusive education strategies, such as communication technique, and then learning disabilities. That is about collaboration with experts, such as psychological therapists, to design specific intervention tailored to the needs of ABK. And then the last is about parent-school collaborate. It's so conduct parents education program to guide families in supporting children at home and maintaining activity communication between teacher and parents to monitoring progress and ensure to consist support at school and home. Question number 6 and the last is about choose one type child in special, for example, children with disturbing hearing or child with disability intellectual, and analyze how characteristic the influence method, the study, design learning, and adaptation strategies, the curriculum that you think is most appropriate for support learning day in a way effective in class regular. The first is characteristic of children with hearing impairments and their influence is learning. The first is about difficult understanding verbal information and their reliance on visual communication and sign language and social isolation. Next is about lesson and curriculum adapting strategies. The first is multisensory memory. It's about visualizing material and technical support. And then it's about incorporating sign language and visual cues. It's about sign language in teaching and visual instructor, like use step-by-step visual aids such as poster or symbol. Next is about curriculum adaptation. It's about simulate content and alternative assessment. Next is about inclusive classroom environment to strategic classroom setup and then clear learning rhythm. And then the last is about collaborates with parent and specialists to regular meeting or specialist support. And the benefit of these strategies is about by employing tailored learning techniques and adapting the curriculum, children with hearing impairment can better engage in regular classes, success academically, and actively participate in social interaction. Support from teacher, parents, and specialists is essential for creating an inclusive and empowering education environment. Okay, that's all. My explanation about my answer in my question. So I close by Paramasanti, Om Santi 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 Om, and reading of harmony. Salam harmony.